Ask Cancer Wisdom is our video series where we answer your questions about cancer. So click the link below if you want to ask us questions about your issue. Also subscribe to our channel if you want more info about natural cancer remedies. So the question in this video is, how does one know when treating cancer naturally if it's working? One way to know if you're improving is by looking at your symptoms. Specific processes happen when cancer is at its height and when you're healing. In 1978, Dr. Ryke Geerd Hamer discovered the mechanism of cancer. Hamer developed testicular cancer when his son Dirk died. He believed that his testicular cancer was due to the emotional shock caused by the death of his son. Hamer then began researching the personal histories of cancer patients. His research extended to more than 20,000 cases. He found that without exception that he could trace cancer to a severe emotional shock. So every shock left a dark concentric ring on the brain confirmed by a brain scan. There was a 100% correlation between the site of cancer and the specific conflict. Hamer later created the 5 biological laws of diseases. The second biological law states that every disease runs in 2 phases. First, we have an active conflict phase at the start of the disease. And when we resolve the conflict, we enter the healing stage. The complete process from disease to resolution goes through identical phases. The psyche, the brain and the body all go through this process at the same time. In the conflict phase, we experience the initial shock. All activities in the body shift to manage the conflict. The psyche is on high alert and we experience distress and worry. The brain lesion corresponds to the area best suited to resolve that kind of conflict. Its size will reflect the intensity of the shock or the duration of the conflict phase. The bigger the shock and the longer we are in distress, the larger the lesion in the brain. Physically, you might feel cold, lack appetite and cannot sleep at night. You can also lose weight, your heart can race and the blood pressure can rise. Stress constricts the blood vessels, which leads to cold hands, sweats and shivering. The conflict active phase is part of the cold period. When we are on high alert, it allows us to focus and resolve the problem. Organs and tissues will respond with either cell growth or cell loss. It all depends on where in the brain the lesion occurs. For example, organs controlled by the brainstem and cerebellum increase cell production. Some examples include cancers of the lung, colon, liver, prostate or breast glands. And organs connected to the cerebral medulla and cerebral cortex will suffer a loss of cells. Some examples include cancers of the cervix, ovaries, testicles, bronchi, milk ducts or bile ducts. Once the conflict is over, the healing phase begins. With the resolution of the conflict, the autonomic nervous system begins to rest. The healing starts in the psyche, brain and organs all at the same time. You know you resolve the conflict when you feel relief and stop worrying about it. During the first stage of healing, you will relax and feel exhausted and weak. Your appetite will improve and the body will get warm again. Therefore, you can feel feverish for a while. During the healing process, the blood vessels expand, causing warm hands and warm skin. This state is the warm phase of the disease and is a positive sign. The brain lesion begins to heal as soon as we resolve the conflict in our mind. The healing follows 2 phases, both in the brain and the body. During the first phase of the healing process, the body creates edema over the lesion. Edema protects the lesion while the reparation is undergoing. It contains water that protects the healing area, which enlarges the swelling. If big enough, it can cause some pain, dizziness, vision problems, or other symptoms. It depends on which relays are pressed by the edema. The healing of the lesion can be seen on a brain scan as rings. This stage of healing then leads to an epileptoid crisis. It's a healing crisis where you experience a sharp but short relapse into the conflict phase. You may feel typical stress symptoms, shivers and nausea. The purpose of this short crisis is to help the body get rid of the brain edema. Your symptoms can vary depending on which area of the brain affected. The healing crisis can cause heart attacks, strokes, asthma attacks, migraine attacks or epileptic seizures in some extreme cases. The second phase of healing begins after the body expels the brain edema. Neuroglia then heals your lesion. They are cells that the body uses to heal a wound in the brain. Sometimes a large collection of such cells can be mistaken for a brain tumor. Organs can also go through the 2 stages of healing as well, at the same time as the brain heals. Tumors that grew during the conflict phase are now broken down and reabsorbed, or it's expelled from the body. Organs that had lost cells during the conflict phase create new cells. This sudden cell growth is sometimes confused as cancer. Specialized bacteria and viruses aid your self-growth. They make the process faster and better, but it can also happen without them. Most of the symptoms we associate with diseases can be a sign of healing. For example, our body repairs tissues through swelling, inflammation, infections, fever, and pain. It's the same process when we heal from a bee sting or a twisted ankle. The intensity and length of the healing phase depend on the size of the initial conflict. An intense conflict can make the healing process longer. It can cause us pain and distress. Often people are afraid of the symptoms of healing, mistaking them for the disease. Pain and fear can make it hard to relax and to let the body heal. Relapses and chronic conditions happen when we can't fully let go. It occurs when there are triggers in our environment that remind us of the initial shock. So if you have these symptoms, don't be afraid and know that you're healing. Another way you can know if you're improving is to do several non-toxic tests. Download How to Monitor Your Cancer to learn 15 non-toxic ways to track your cancer prognosis. By following this guide, you can discover how well you're doing. The link to this free ebook is in the description box below. Thanks for watching, and I see you soon.